This is a 71-year-old male, status post right shoulder replacement, actually a bilateral shoulder replacements, but today we're going to just focus on the right one. Unfortunately, that was replaced about 5 years ago, and he's had pain really since the surgery. He also feels like the shoulder locks when he extends his arm outward and kind of grabbing below the waist, or let's say something on the floor or under the table. And unfortunately, no real reason has been found why this has been going on. He's had multiple follow-ups and x-rays, and fortunately hardware seems to be well positioned and well placed, and he had an MRI done about a year ago, which a little difficult to read just because of all the metal artifact. As per my read, there is pretty significant subscapularis muscle atrophy and mild supraspinatus atrophy. The MRI report discusses mild to moderate AC joint arthrosis and also does mention moderate fatty atrophy of the subscapularis muscle, which I was able to see on the MRI as well.
Of note, when I made this ultrasound video, initially I did not know whether or not this patient had a biceps tendon tenodesis, as I did not see the op note. However, upon finishing this video, I did see that he did in fact have a biceps tendon tenodesis. So as you will see through this video, I will be questioning whether the biceps tendon ruptured or was tenodesed. Here we're going to go ahead and look at the biceps tendon in short axis. The probe is in an axial plane over the anterior shoulder. I can see that bicipital groove and that sulcus between the greater and lesser tuberosities, but I don't really see a discrete ovoid hyperechoic structure of the biceps tendon. So it looks like that tendon is not there. It could have been perhaps tenodesed during the surgery. Here I'm trying to find it in long axis. So I'm starting off lateral and I'm doing a sweep over the humeral head and shaft. And again, I don't see any fibular structure of any thickness or significant thickness along the humeral shaft going against, again, any kind of visible biceps tendon, at least proximally. Here I'm going distally down the shaft. We can start seeing the biceps muscle. It does look a little bit hyperechoic, and I think it looks small, consistent with atrophy. This again could be that the biceps tendon was released or perhaps tenodesed. Now I'm trying to find the subscapularis tendon. We can see the prosthesis, which is that very bright curvilinear structure underneath the subscapularis, and you can also appreciate the lesser tuberosity. The subscapularis tendon to me looks a little bit thin here, and that would be pretty consistent with the fact that he has significant and severe atrophy of that muscle based on the MRI. Now I'm trying to find that tendon in short axis, and you could see a tendon again quite thin, consistent either with moderate or high-grade tearing or just general atrophy of the whole subscapularis muscle and tendon. Now I'm going to look at the supraspinatus tendon in long axis. We can see the prosthesis, and we can see essentially the superior facet of the greater tuberosity, and you certainly see a supraspinatus tendon. There may be some intrasubstance tearing versus just anisotropy. There may actually be some moderate tendinosis. The tendon actually looks pretty thick here, the very anterior aspect of the supraspinatus tendon. And this patient essentially had pain with active motion, but fairly well preserved range of motion, which is consistent with this ultrasound. Can appreciate a reverberation artifact under the prosthesis. Now we're going to go ahead and try to look at the supraspinatus tendon in short axis. And unfortunately for the rest of the procedure, I don't have a video of the actual placement of the probe on the patient, and therefore I'm using a purple oval essentially to mimic the probe. So again, here we can see that prosthesis. And again, we do see a fairly substantial tendon. So I don't think lack of tendon or rotator cuff is the major issue here. Here the supraspinatus tendon looks quite thin, but I think we're getting close to its insertion on the greater tuberosity, and I think that's why it's thin. I don't think it has such a severe tear causing that appearance of being thin. Here again you can appreciate fairly normal thickness supraspinatus tendon, I believe. You can see it laying over the prosthesis. And now as part of this protocol, I was asked to assess the actual bulk of the supraspinatus muscle. Again, there was some mild atrophy on MRI here. I don't appreciate a whole lot of atrophy. It looks like there's a pretty thick supraspinatus muscle underneath the deltoid muscle. You can see it sitting essentially in that supraspinous fossa. And here we can actually appreciate the scapular spine and the clavicle, and the supraspinatus muscle sits deep to those, and again over the supraspinous fossa. And now we're going to go ahead and look at the infraspinatus tendon in long axis. Here you can see the muscle, and the infraspinatus tendon is essentially centrally located within the muscle. And here you can see a infraspinatus tendon attaching on the middle facet of the greater tuberosity. There may be some thinning and some atrophy, a little bit hard to judge for sure, but certainly there is an infraspinatus tendon. And you can see how that tendon lays directly over the humeral head prosthesis. And now we're going to go ahead and look at it in short axis. So we can see the infraspinatus tendon to the left, teres minor to the right. And we're going to watch those two tendons converge. I think there's a fair amount of artifact within the infraspinatus tendon region, making it look smaller than you would expect, as normally the infraspinatus tendon is about twice as thick as the teres minor tendon. And here you can see those tendons converge as they insert on the middle and inferior facet of the greater tuberosity. Here we're going to go through an MRI review of this patient. We're going to actually scroll through the MRI. Here we can see coronal images, which are fat saturated. Here at the anterior aspect of the shoulder, going posteriorly, you can see that prosthesis. It's really hard to get a good sense of the rotator cuff, particularly the supraspinatus tendon, just given all the artifact of the metal. Now we're going to look at a sagittal view. Again, here we're looking at the prosthesis. You can see the stem going down the humeral shaft. And again, you have all this artifact around the metal. You can appreciate significant subscapularis muscle atrophy and mild supraspinatus muscle atrophy. Actually, probably more moderate supraspinatus atrophy as you go distal towards the greater tuberosity. And here we're looking at the deltoid muscle at the very lateral aspect of the shoulder. Here we're going to switch to axial views. Again, you can appreciate the stem of the component within the humeral shaft. Here we're going distally down the humeral shaft. And now we're going proximally. You can see the pectoralis major tendon going across. And underneath it, there's this low signal sliver, which could be a biceps tendon. It's very subtle, and I'm not sure if, in fact, that is part of a remnant long head biceps brachii tendon. And here we're going proximally. We can see this ovoid low signal structure, which essentially is artifact from the prosthesis. And here we're again at the top of the shoulder. You can appreciate the prosthesis. Here's the acromioclavicular joint, and we're going back down distally down the arm again into the shoulder joint itself. And here you can appreciate the stem of the prosthesis. Here we're going to go ahead and do an anatomy review of this case. Here we're looking at normal anatomy. You can see the rotator cuff. The deltoid muscle is essentially translucent. And here we're looking at the back of the shoulder. And now we're doing a bird's eye view. We can see the supraspinatus muscle. You can see how that goes underneath the acromion, where sometimes you can get impingement. And now we're looking at the anterior and lateral aspect of the shoulder. And we're making the pectoralis major muscle translucent. You can see the underlying pectoralis minor muscle attaching on the coracoid process. And here again is the rotator cuff. And here you can see the posterior humeral circumflex artery and vein. And here you can see the acromial branch of the thoracoacromial artery. And now we're rotating anteriorly. You can see the cephalic vein and the pectoral branch of the thoracoacromial artery, as well as the subclavian artery. Here you can see the short head of the biceps brachii muscle. And you can see its tendon attaching on the coracoid process, as well as the pec minor tendon attaching on the coracoid process. And now we're hiding the neurovascular structures. And here you can see the subdeltoid bursa. And here we're showing a model similar to the patient's shoulder prosthesis. You can appreciate a pegged glenoid. And you can see the humeral component with the stem going down the humeral shaft. Here's a bird's eye view of the prosthesis, and that would be similar to an axial view on MRI. And here we're showing this patient's pathology, where I believe he has a ruptured versus a tenodesed biceps brachii long head tendon. Also, he has a diffusely thin subscapularis tendon, which is a little difficult to appreciate on this model. He also has a thickened anterior aspect of the supraspinatus tendon, and I believe somewhat of a thinned posterior aspect of the supraspinatus tendon, and the infraspinatus tendon appears to be thinned diffusely, which we demonstrated here. Again, here we're showing the ruptured biceps, so you don't see a biceps tendon in the interval. And here we're bringing back normal anatomy. We're bringing back the biceps brachii long head tendon, and we're making the supraspinatus tendon normal in thickness, and as well as the infraspinatus tendon as well. And here you can appreciate the subdeltoid bursa, how it's a broad bursa that essentially covers the rotator cuff. And here again is a model similar to this patient's shoulder prosthesis. Again, you can appreciate the pegged glenoid. And here we're making the bone opaque, and you can appreciate how this prosthesis nicely emulates the normal anatomy of the shoulder, with the humeral head fairly well centered within the glenoid. And here we're looking at this prosthesis from a posterior perspective. And here again we're looking at it from a bird's eye perspective, where you can get a good view of the supraspinous fossa and the suprascapular notch. Here we're going to do a cross-sectional anatomy review. We are essentially just focusing on the rotator cuff and the bony structures and the shoulder prosthesis. Not included in this tutorial are the shoulder capsule and shoulder ligaments. Here we're going to go over sagittal views of this patient. Here we're going from a lateral to medial direction. You can appreciate some thickening of the anterior aspect of the supraspinatus tendon, which overlies the prosthesis. You can also appreciate some thinning of the subscapularis tendon anteriorly. You can also see the infraspinatus and teres minor tendons posteriorly. And now we're cutting medially. Again, you can appreciate the prosthesis. You can appreciate the stem of the prosthesis going down the humeral shaft. And now we're going further medially towards the glenohumeral articulation. And here you can see the very tip of the prosthesis articulating with the glenoid component, which is essentially a pegged glenoid, which you can appreciate here as you see the pegs essentially going into the glenoid. You can also appreciate here the coracoid process as well as the scapular spine and the rotator cuff musculature. And again, we're going medially, and you can appreciate the teres minor, infraspinatus, supraspinatus, and subscapularis muscles. And here particularly you can see how thin the subscapularis muscle, consistent with this patient's severe atrophy of the subscapularis muscle. Now we're going to go over coronal cross-sections through this patient. Here we're approaching the subscapularis muscle and we're beginning to cut through the supraspinatus tendon, and here you can see a thickened anterior aspect of the supraspinatus tendon. You can also see the prosthesis, and we can see the glenoid component here. You can appreciate the pegs essentially going from this glenoid component through the glenoid that was reamed, and you can see the stem of the prosthesis as well. And now we're going posteriorly, and here we're in the infraspinatus and teres minor muscles, and here you can see the scapular spine as well. Here we're going to go over axial views. We're starting essentially at a bird's eye view, looking at the top of the shoulder. We're going through the acromion now and through the supraspinatus tendon. Here you can start appreciating some thickening of the anterior aspect of the supraspinatus tendon and some thinning of the posterior aspect of the supraspinatus tendon. Here you can see the prosthesis with the prosthetic head articulating with the glenoid. You can see the pegs going through the glenoid as well. Here you can start seeing infraspinatus, subscapularis muscles and tendons, and here you can see teres minor, and here you can see the stem going down the shaft of the humerus. And here you can also appreciate some thinning of the subscapularis muscle consistent with this patient's atrophy. Thank you so much for watching this video. I hope you found it helpful. If you're interested in learning more about musculoskeletal ultrasound, please visit www.probeultrasound.com, and on that website you can also see information about upcoming musculoskeletal ultrasound conferences. Thanks so much.